Thank you for any students that are joining us, or prospective students that are joining us today for this St George's event to look at different undergraduate degrees. And today our team are from the undergraduate healthcare science program. So I will introduce you to Amel, who's one of our students later, and who's joining us later for just to explain her experience of being a student. For now, I'm going to introduce Martin. Martin, would you like to introduce yourself, please?
Good afternoon, everybody, and thank you for your interest in St George's Healthcare Science. I'm one of the senior lecturers in respiratory and sleep physiology here at St George's. Nice to meet you all.
And Eloise, if you'd like to explain who you are.
Hello, my name's Eloise. I'm a second year clinical physiology student specialising in respiratory and sleep.
And I'm Stephanie. I am a senior lecturer in cardiac physiology and I teach on the programme. So if you'd like to go to the next slide, please. Thank you, Kerry. So first of all, I'd like to explain what healthcare scientists in physiological sciences is. So we are a group of clinical people who work in the NHS and in private practice, and some of us even work in industry. And we perform the majority of diagnostics in hospitals and many of the therapeutics. And at St George's University, we have two specialities, and the two specialities are cardiac physiology and respiratory physiology, and that's what we'll be talking about today. Now, why is it a PTP undergraduate program? That's because it's been accredited by the Academy of Healthcare Science. So once you've completed this course, you can actually register as a clinical physiologist. Next slide, please. So what do we do as clinical physiologists? Well, we can do diagnostics, ECG, that's a recording of the heart, echocardiography, that's an ultrasound diagnostic of the heart. We can do all of these things in diagnostics. And we also are involved in therapeutics as well. Some of the therapeutics involve respiratory, some of the therapeutics involve cardiac implants, and sometimes we're even called in the middle of the night to stop people from dying from heart attacks. So that's part of the therapeutics we do as well. And we also look at new therapies and new diagnostics, and we educate patients on their healthcare. So a patient who has asthma may well attend a respiratory clinic and they'll be educated on how to manage their asthmatic issues. We also can become clinical scientists. So this is when we have advanced practice. And in advanced practice, we can run our own clinics, and that may be a sleep clinic or a valve clinic, or if a patient has chest pain, they may attend to find out why they're getting that chest pain. And eventually, actually, you can become a clinical scientist, or you can even become a consultant scientist. So, Martin, would you like to explain some of the diagnostic and therapies that we see in respiratory?
Yeah, there's lots and lots of different diagnostics, and again, it's about the diagnostic tests, performing them, but also the analysis and the interpretation. And I'll show a few pictures a little bit later of some of the diagnostics. But there's tests you may have heard of called spirometry, a common procedure. Our year one students make this out on placement, as do our year two, year three students. And it really gives a measure how well the lungs are working, how clear the airways are. And there's other tests that measure the size of the lungs, gas exchange across the lungs. I'll show a picture a little bit later of some allergy tests as well, also assessing the oxygen levels in the blood. We can use pulse oximeters. We can take samples of blood from the radial artery or the earlobe and lots of other tests.
So as you can hear, it's a very complex profession, and we really welcome people who are not only interested in anatomy and physiology, but also in the technology that's involved in diagnostic and therapeutics. So if we could have the next slide, please. So in daily practice, what does this look like? Well, as a practitioner at the end of this program, you can be working in a team involved in invasive work, so working in cardiothoracic theatres. You can be working as a single practitioner, performing tests on your own and reporting the tests, and even sort of directly reporting back to a general practitioner, so without having to go through any medical doctor within the hospital. And so as you can see from the pictures, there's a whole range of environments that you can work in as a clinical practitioner. And your daily practice may change from one day to another. You may be conducting routine tests one day. The next day you may have to deal with emergencies that come into your department. So if I can have the next slide, please. So some of the highlights of the program. So across the 3 years, we will teach and discuss professional practice. Now, this is really important because at the end of this course, you will be seeing patients. You'll be seeing patients as an independent practitioner. You'll be making really important decisions about the patient's life, about their future, about their health. And so it's really important that you are trained to be a real professional. And Martin and I both were practitioners, and we know how important this part is. The second bit, which is really exciting, is placement for clinical training. So across the 3 years, you are in a department, you're part of the team. I think it's about 50, Martin will probably correct me if I'm wrong, it's about 50 weeks across the 3 years. And in the third year, the clinical training is probably one of the most important aspects of the undergraduate course. And in fact, many of our students actually get asked to apply to the place they were at placement. The students are thought of so highly in placements. Then another part of the program is scientific basis of physiology and pathophysiology. So we really teach you all of the fundamentals that you have to know to go on to be a really good practitioner in your field. From the first year, you will be doing respiratory and cardiology, but after that you can choose. So you may be more interested in the respiratory side, or you may be more interested in the cardiology side, or at the beginning, you might not even know which one you're most interested in, but at that point, you can make your decision. And during your time on site at the university, also at placement, you will have supervised practice in your specialism. So you'll always have somebody looking after you, checking that your theory and your skills at practice are to the standard that's required. Next slide, please. So Martin's going to speak a little bit about the respiratory and sleep physiology selection. So thank you very much, Martin.
Thanks. So I just wanted to talk about sleep physiology. It's really complex and quite a new area of medicine and a real integral part of the degree. And there's lots and lots of weird and wonderful sleep disorders out there, such as restless leg syndrome, insomnia, narcolepsy, sleep nightmares. This degree really focuses on something called obstructive sleep apnea, which many of you may have heard of. If not, go away and have a quick read up on sleep apnea. It's where people stop breathing many times during their sleep. It disrupts their sleep. It makes people very tired, very irritable. People may fall asleep driving. People may fall asleep at work. So our skilled workforce are key to the diagnosis of this disease. And we perform sleep studies, and the diagram on the left-hand side is a very complex sleep study. There's a range of different types of sleep study. So our course prepares our students for actually setting up these complex sleep studies, either on an inpatient basis or on an outpatient basis, but really key to analysing lots of the key data. I've got a picture in the middle of some very complex data which healthcare scientists are analysing, and also interpreting this data to identify and diagnose sleep disorders. Our Year 2, Year 3 students are also involved in the treatment of sleep disorders as well. Just got a picture of a person there attached to a machine called a CPAP device, and that just keeps the airways open and keeps the patient breathing during their sleep. So it stops them being tired, and it really improves the quality of their life and stops them leading to very serious health conditions such as diabetes, heart failure, etc. So a really skilled procedure, and the degree will prepare you for the diagnosis and treatment of these disorders. Next slide, please, Kerry. So as I said, we will teach you and increase your knowledge of anatomy, physiology, but also the pathophysiology, so you'll understand lots of the key diseases and disorders you come across, whether that's COPD, asthma, sarcoidosis, pulmonary fibrosis, cystic fibrosis, obstructive sleep apnea, and you'll be experts in those diseases. And as you go out on placement, again, building into what we teach you at the university, this exciting blend of academic and clinical practice, which you will all enjoy. You'll start to put your skills to practice in your placement sites, making high quality, accurate clinical measurements of respiratory and sleep disorders, and of course of cardiac conditions as well on your cardiac placements. So starting to put what you learn into practice. And I'll show some diagrams on the next few slides, but a wide range of investigations. So as I mentioned, allergy tests, exercise tests. We can assess respiratory muscle performance. We can measure the size of the lungs, etc. And all how they fit into relevant care pathways. Again, the diagnostics that you will be performing, analysing, and the treatments are key to the treatment, management and care of your patients and their families as well, making a real impact on people's lives. Kerry. Next slide, please. Yeah, and on the far left-hand side, we've got a patient sitting inside a box called a plethysmograph, and we can see we've got a healthcare professional. So we've got this direct patient contact with patients of all ages performing a wide range of lung function tests. So we can perform a test called spirometry. It's quite a difficult test for patients to perform, where patients blow into the mouthpiece as fast as they can and as long as they can. And we make some key measurements. I've just put a graph under the diagram, something called a flow volume loop. So again, we're making good quality measurements. We've got lots of data. We're analysing the data and we're interpreting the data. And our students are doing that from as early as Year 2 into their placement. We can also measure the size of the lungs. Are the lungs too big? Are they too small? Are the lungs normal size? And we can look at gas exchange across the lungs, which is disrupted in conditions such as COPD, emphysema, and pulmonary fibrosis. In the middle, just got a picture of an allergy test. So again, healthcare scientists, respiratory physiologists are involved in assessing patients to see if they've got allergies. And that could be to things like molds, dog, cat, house dust mite, pollens, etc. And again, links in with patients with asthma who may have multiple allergies. And on the far right at the top, we've just got a picture of somebody taking a sample of blood from the earlobe We can also take samples from the radial artery as well. So again, we can assess the oxygenation, how much oxygen's in the blood, how much carbon dioxide's in the blood pH, and we can assess if patients are in respiratory failure. And just at the bottom, we've got a patient, we can see a patient walking with an oxygen cylinder. So again, healthcare scientists are assessing patients to see if they need oxygen. That's an example of ambulatory oxygen. So the patient can go out and about, they can go to the shops, they can walk, they can play with their grandchildren, they can do their gardening. So again, we're improving the quality of patients' lives. So again, assessment, diagnosis, and treatment of disease. Thank you, Kerry. Over to you, Steph.
Thank you. Thank you, Martin. I think you explained so well and so fully, what a brilliant career being a respiratory sleep physiologist is. Now to talk a little bit about cardiology. So cardiac physiologists can perform many diagnostic tests. And so in this screen, on this slide, we can see a echocardiogram being performed by a cardiac physiologist. So this is an ultrasound test that shows you the function and the movement of the heart. So we have a live picture of the heart pumping blood to the various parts of the body. And here we can look to see whether patients have got abnormal valves, so the valves between the chambers of the heart. Is the blood pumping around the heart the way it should be? Is all the muscle working properly? So when a patient has a heart attack, part of their heart muscle actually dies. And by performing this ultrasound test, we can actually see whether the heart is pumping properly. On the other side of the screen of this slide, you can see a cardiac physiologist performing a cardiopulmonary exercise test. Now here we have a little bit of an overlap with Martin's profession of respiratory physiology, in that both of us will perform cardiac pulmonary exercise tests, but we will analyze and report the tests a little bit differently, whether we are more sort of cardiac focused or respiratory focused. So there is a really good overlap between cardiac and respiratory, and work very closely as colleagues. At the top of the screen, you can see somebody in a mask and a hat. So they're working in a clear, clean, clinical surgical environment. And what they're holding in their hand is a little recorder that actually records somebody's heart rhythm. It stays inside the body, and we can interrogate this little device and find out whether somebody's having abnormally fast or abnormally slow heart rates. Next slide, please, Kerry. So what's involved? So again, as in the respiratory selection, we will look at the breadth of science in cardiac physiology. So we will look at cardiac pathophysiology. This could be valve disease, muscle disease. This may be that the heart is beating abnormally, that the patient maybe when they exercise, they go into abnormal heart rhythm. And we also look at how we can help patients who have these abnormal rhythms by putting in devices that can make the heart beat faster, or they can actually treat fast and very, very dangerous arrhythmias. So there's a whole plethora of therapies that can be given, or we're part of the team that give these cardiac therapies. Next slide, please. Thank you, Kerry. And so in this slide, we can see somebody performing an ECG on a patient. These are electrodes that are put onto somebody's chest, and from the electrodes, we get an electrical recording of how fast the heart is going. We can see from this recording the health of the muscle of the heart, or whether there's any abnormal rhythms. In the middle of the slide, we have a team of people, so we can be part of a team that treats abnormal rhythms. And what we actually do is we go into the heart, we take recordings, we create a 3D mapping image of the heart, and we find the parts of the abnormal heart rhythm that aren't working properly, and we actually go in and destroy the abnormal heart rhythm connections. And on the other side of the slide, this is a echocardiogram, as I spoke about before, being performed. And again, the cardiac physiologist is looking at the form and the function and the flow of blood through the heart. Next slide, please, Kerry. So clinically, we are really important to a patient's pathway going through diagnostics and treatment. So a patient who comes in with a heart attack, say, they will come into contact with a cardiac physiologist. A patient coming in respiratory distress will come across the respiratory team, but also there's overlap. So patients who may come in for problems with their kidney or their liver or some other part of their body system will come into contact with respiratory physiologists and cardiac physiologists, because we're so important to make sure that patients are healthy or well enough for some of the treatments they receive. So we're incredibly important to the whole clinical team. We work in teams, so we work with nurses, radiographers, medical staff. So a lot of our daily working practice is working with this team, informing them as experts in our field, and collaborating with them to make sure that patients have the best opportunity to health. So there's other considerations to think about. There are really outstanding opportunities for graduates. One doesn't have to stay working in the National Health Service. There are many opportunities in industry as well. And there's also the scope to go into research or stay within the field of clinical work and possibly becoming a consultant clinical scientist, or even maybe managing your own department one day. Martin, have you got anything to add about any of those considerations?
Yeah, I just want to go back on a quick point, actually. As a point about clinical placement, in year one, students get access to both cardiac and respiratory placements, and then get to choose their specialty, cardiac or respiratory sleep, for year 2, year 3. That's a huge advantage of our programme. Lots of universities that people may be looking at, just for example, offer the cardiac physiology stream. So again, with our programme, you actually get the choice of cardiac or respiratory sleep. Because some people actually do change their mind, so it's great to have a choice. So I would just add that in as well.
Yeah, that's a fantastic point, Martin. Having the opportunity to do both specialities from the forefront means that, first of all, you get a wider experience of both professions, and secondly, you can really make a very, very informed choice after your placement in that first year. So if we could have the next slide, please. So yes, I've put what does success look at. So it's a bit cheeky that I've actually put myself in here, but just to say that you don't need to stay necessarily in clinical practice. There are other routes once you have completed this degree. But success looks a little bit like this. Chris is actually one of our students, I think from about 4 or 5 years ago now, and he's actually a lecturer on part of our course. So he's come in recently and lectured on AI, artificial intelligence, in cardiology and respiratory. So it's quite amazing, really, the progression of our students, that within 5 years they're actually coming back to us as experts and teaching the next cohort of students. So really and truly, the amazing thing with this degree is, firstly, you do have a job for life. I mean, there's a real shortage of cardiac physiologists and respiratory sleep physiologists in this country and internationally in many ways. So you'll never not have a career. And secondly, there's so many opportunities these days to progress and to a very, very high level. So it is a fantastic career. I mean, Martin, I mean, we both think it's a fantastic opportunity, don't we?
Yeah, and people just don't know about healthcare science. So it's great that people have joined us today to actually hear about this great role. I'm sure we'll hear from Eloise as well. This great role that our healthcare scientist workforce do in patient diagnosis, treatment, management, but also, with changes of technology, with research, innovation. The scientific workforce is so useful, and the demand for jobs. There's huge demand for skilled healthcare scientists, and with trends in obesity, aging population. There's lots of work to do, so we need a skilled workforce. So come and join us.
Yeah, it's an amazing, amazing career, I have to say. I mean, I was in clinical practice for nearly 35 years, and I loved, I really loved it. Now I'm in academia. I love that as well, but, it is a fantastic career. So if we could have the next slide, please.
Oh, that might be it, Steph.
Okay, so that's just the presentation now. We are now going to go and ask two of our students to talk about their experience. But thank you very much for listening to this part of the presentation. And we're now going to go to Eloise and Amel. So Eloise, would you like to talk a little bit about your experience? And I think Amel will join us a little bit later.
Hi, my name's Eloise. I'm currently in year 2 of clinical physiology and I'm specializing in respiratory and sleep. And my current placement site is at Great Ormond Street. I was originally interested in sleep science, and research into this area led me to find this degree. And I really liked the clinical side of it as well. And I also liked the fact that there was as mentioned before, a cardiac and respiratory combination. I think it was so important to have that and have placement sites in both cardiac and respiratory in the first year, so I could make the decision. And I find the workload in year 2 very manageable so far. But first year is a big jump from A level, so I would recommend making an effort to balance everything, get into good habits early on, and don't be afraid to ask for help and support. Everyone is so helpful and supportive on the course, and it's just been a lovely experience for me. I've also learnt so many skills, whether that be academically in lectures or practically on placement. And I've gained so much knowledge about various diseases, how they affect patients, as well as I gained experience dealing with patients as well. I also par from the course. I take part in a Politics Society and go to lessons every week, which is a great way to de-stress from placement and deadlines. And I'm also a very avid gym goer and I'm very interested in exercise and health, which is really good for my course. I find it so interesting learning about lung function and lung diseases. And I would also really recommend living in halls in your first year. I was really lucky with my flatmates and ended up in a flat of 6 living with 2 other people who were on my course, one who's chosen cardiac and one who's chosen respiratory. So that was really helpful. And we supported each other through exams and various assignments. And I even lived with 2 of my previous flatmates this year in private accommodation. So I'm so grateful to have had that. And I've found some really good lifelong friends. My favourite spot to go in Tooting is East Tea & Co. And my flatmates and I love bubble tea. And this place is great. Rose's Thai is great. And if you like Sri Lankan food, like me, Jaffna House and Kotu are really amazing places. I was really worried moving to uni and whether I'd make friends, but my advice is just try and get involved as many things as possible. I know Freshers Week, there's so many events going on over the 2 weeks, and the Freshers Fair is so helpful as well. So please get involved in that. And yeah, I've loved St. George's and I'm having a great time. So thank you.
Brilliant, thank you. And it's been it's as always, because we have a really small cohort. So Martin and I, as academics and lecturers, we get to know our students really well. And every year, I mean, the most pleasure from the course is the brilliance of our students. So saying that, I will let the brilliance of our students shine out, and Amel can now speak to you about her experience.
Thank you, Stephanie. So hi guys, my name's Amal. I'm a third year student specializing in cardiac physiology. I actually really found it because I'm a mature student, I found it on a fluke. I was just talking to some people at work, and it is a very unknown subject, but it's such a great career. It's such a great learning experience being at St. George's because they're really supportive. They really guide you through everything. And because you have such a small cohort, you get more one-to-one time with your lecturers, you get a lot more support. And I think that's really great. In the first year, you do have like shared lectures with other people, with other courses. You get to make friends not only in your course, but with other courses as well, which I found really interesting and really fun to do. And then as Eloise was saying, it's such like as you're going through the years, I feel like you do gain so much more experience and so much more knowledge. And I think the beautiful thing about going to St. George's is that they give you so much placement time, which means that not only do you get to learn a lot from the wonderful lecturers, but you get to apply that knowledge too. And like for people like me who don't can't really process all the information straight away, I think applying it and getting to see that in action with patients and interacting with the different people from your field is so beneficial, and you really get to test your knowledge real time with patients and work with different people and just get to explore more. And yeah, as they were saying, cardiac physiology, I chose to go into it because I really like the heart. I really think it's so interesting. And the world of cardiac physiology means that you have so many, there's so much subspecialties that you can go into. Today I was in cath labs, which I found really interesting. We were doing catheter procedures on patients who had heart attacks or people who had just come in from different countries coming for these procedures. So it's a really eye-opening experience. I personally didn't live in halls, but I did commute, and it's definitely manageable to commute and still get involved in uni life. So in my first year, I got involved in the rowing club, which was really fun. I got to make a lot of friends, go to a lot of socials. And yeah, in second year, I picked up a job, so it was a bit harder to manage all of that. But it's definitely doable. It's definitely a, a great course. And to be honest, I wish that I knew about the course earlier in my life. I'm sure that a lot of other people could say the same, especially when I work with other people at work. They always say the same thing, that they wish they had known about it earlier. And I think George's is a really great place to learn. As they said, in the first year, you get to experience both. And I think that's really great if you don't know exactly what you want to do or you just want to have a bit of experience of what it's like. I think opening your eyes to both specialties is really eye-opening and really great experience. And getting just to talk to people in their field is really great as well. What do I like about tutoring? I like the uni, actually. I like that it's based in a hospital. I like that you can walk around and feel like, I'm here where I'm going to work. But yeah, I definitely do some more research into healthcare science. And thanks for coming to the talk today. If you have any questions, feel free to ask or feel free to message either me or I'm sure Eloise on UniBuddy, and we'll be happy to answer any questions you have.
Thank you so much, Amel. So I've got a couple of questions for you both. So far in your placements, what was your most exciting day on placement? So I'll ask Eloise that first of all.
I don't know whether it was exciting, but my most rewarding day was I had a patient who we needed to do spirometry on because they were post lung transplant. And looking back at their results pre-surgery and post-surgery were just amazing, and seeing that difference in their health was so great. And knowing that us as healthcare scientists were a part of that, and the patient was just so happy and their quality of life was so much better. So I'd say that was one of my favorite days on placement.
And Mel, your most exciting or most memorable day on placement so far?
I have a lot of memorable days. To be honest, I really enjoy placement. I think it's really great learning experience. But I would have to say labs. I would say being in a cath lab is just very exciting. Being with like a team, being with other people working in the field, having like the rush of a patient coming in from a heart attack and trying to set them up as quickly as possible and guiding the doctors through, making sure you're monitoring the patient throughout. I think, and actually seeing the patient successfully having their stents put in and knowing that you were there to help save that person's life, I think is very rewarding and very engaging and very fun. And the days just really the hours just go really quickly. So yeah.
Yes, it's fascinating, isn't it? It's sometimes what you would imagine be the most frightening and scary circumstances sometimes become the most interesting ones, because we're really dealing with people who, are suffering from either very urgent emergency situation or some chronic illness that we really need to palliate, and we need to help them through that time in their life. So I think you're both right. I think both of those examples are very rewarding examples. So now, to turn it on its head, and this could be academic or placement, what do you think has been the most challenging part so far? So again, Eloise, if you can have a little think about the most challenging, not obstacle, but the biggest challenge for you so far during this process.
I'd say gaining confidence and being independent. I think in my first year, I was very nervous about placement and doing things right, and making a good impression to your colleagues. And that was really, really challenging to try and overcome that. But I'm so grateful for the time that we have on placement, and we have so much exposure to clinical practice and patients, and as you go on, it gets better and you improve so much and you learn so much. So it was really it was great, but I would say very challenging in the beginning.
Yeah, amazing. I completely understand. I mean, I was a student once, and I know when you're first in that environment, it's like, what is going on? I'll never get used to this. But it is how you develop and change is incredible. And the same question, Amel. What has been the sort of biggest challenge so far?
I'd say actually starting uni when you actually have that jump in the learning experience. Like as Ellie said, it is a big jump going from sixth form where they essentially handhold you through that process to university where it's a lot of more independence. But I really enjoyed the lectures, the lecture content that you give. You learn so much and you get so much support being with lovely lecturers like Stephanie and Martin and Cynthia, and they're so when you have any questions at all, they're always happy to talk you through it or give you a call or do a meeting to kind of go through and explain these things to you. And I think having that support, or even the university itself, they do courses to help learn what type of learning style is best for you. And I think getting over that initially is really difficult, but once you kind of find your feet, I think it's very rewarding, but it's very difficult at the beginning.
Fantastic. So Martin, thank you very much, Martin, for fielding some of the questions that have been coming in. We probably have about 8 more minutes where we can answer any questions. So if you are out there, do type some questions in and we will try and answer them. And while we're waiting for that, I would just like to say thank you so much, Martin, for joining us today and speaking so eloquently about respiratory sleep program. Thank you to Eloise and Amel. You know, all our students are fantastic, but it was really nice of you to join us this evening. Just to say, you know, we had a few little teething problems on this new platform we're using, UniBuddy. Really like it. If you join us at the St George's University, you can become a UniBuddy ambassador and maybe help show people our wonderful program in future years. It's been fantastic evening. Hope to use UniBuddy again. As I say, it's a really good platform. Once me and Martin, the sort of old fellas that we are, get used to it, maybe we'll put it in the hands of the students who are a bit more tech knowledgeable than us. And yeah, so hopefully if we have some questions come in, we'll be answering them for you. So people have asked about CVs when applying through UCAS. No, you just apply through, as Martin's saying, you just apply to UCAS in the same way you'd apply to any course. Do if you're applying through UCAS, do make it give us any experience you've had working with people or any experience working as a volunteer, because that's always great. We expect biology to be quite high up in your qualifications. If you look on the St George's website, if you go to healthcare science, physiological sciences, and have all the information about what you need to get into our course. And if you are invited to interview, you'll be seeing Martin and myself there. With some other colleagues from our program. All our MMIs are run by people who are connected to the course. So we don't run our MMIs, which is the way we interview, with anybody else except for people who are actually involved in the course. Let's have a look, see if there are any. Is there enough time at uni to do both course and have a job outside university? One of the good things about the degree course is that you can actually work as an assistant during the summer holidays. So you can become an assistant cardiac physiologist or assistant respiratory physiologist. So you can actually learn while being paid. But I would say during the sort of academic year, I would probably avoid working if you can, because there is a lot of content. To one of the students said they had a job in hospital, what kind of job do they have previously? So, Amel, Eloise, do you want to answer that one? What sort of job were you doing before?
I personally worked in a hospital, so I've worked in a couple of places. I worked in ICU, I worked in outpatients, I worked in small behind-the-scene admin. In all of those, I got to meet. I think I've met like some respiratory physiologists who are really lovely, who are doing sleep studies on children, which I'm sure Eloise is doing now with her experience and stuff. And I think talking to them really opened my eyes to healthcare science.
And that's how you found out about.
Yeah, exactly.
Yeah, fantastic. People always find out about the degree some weird, strange way. It's really bizarre. So I don't know, is there any other questions that, Martin, can you see any other questions that have come in?
There's one that says if your personal statement is tailored to another healthcare course, but cardiology and motivation for healthcare are still mentioned, is this okay?
That's fine. I mean, we completely understand if somebody is looking at a range of courses across the healthcare spectrum, if you are saying you're interested in working in health and you apply for this program, that is fine. You know, we'll still invite you for interview because we know actually at this stage in your life, we probably don't know all the courses that run. So if somebody wants to work in health, they might not know whether they want to be a cardiac physiologist or a respiratory physiologist or a perfusionist or an occupational therapist. So yeah, it's not an issue if in your personal statement you've written about some other program. I would say when you come to interview, do make sure you do a bit of research on cardiac and respiratory physiology before that interview, though. And anything else in the chat we want to address? Because I think we're probably now a couple of minutes to completing. Right, so I think in the last 2 minutes, we can all say goodbye. Thank you for joining us. If you do want to know anything more about the course, do get in touch with Amel on UniBuddy. I think Eloise may be also on UniBuddy now on the site. You just type them a message and they will be able to answer you. And if they can't answer you, they'll get hold of either Martin and myself. And the stream will stop at 4 o'clock. So thank you very much for joining us. If we all want to say goodbye, I'll say goodbye from me. It's goodbye from Eloise.
I think I've frozen.